Postural changes after age 50, particularly anterior pelvic tilt, commonly manifest as protruding lower abdomen and lower back tension despite unchanged weight. Today we're covering 3-step pelvic realignment system specifically designed for aging bodies: hip flexor release for tension reduction, glute activation for muscular reawakening, and movement retraining for pattern restoration. These movements address hip flexor tightness from prolonged sitting, inactive gluteal stabilizers, compensatory movement patterns, and pelvic misalignment. When practiced correctly and consistently, they help restore natural posture, reduce lower back strain, improve standing comfort, and support functional movement quality. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have hip problems, lower back conditions, knee issues, recent surgery, or chronic pain conditions. Understanding pelvic position and postural adaptation after 50. Walking provides excellent cardiovascular benefits but trains body primarily in forward direction, while daily life requires multidirectional movement including turning, reaching, lateral stepping, standing from chairs, and gravity stabilization. These movements depend heavily on hip and pelvic position and stability. After decades of sitting, driving, or desk work, hip flexor muscles at front of hips gradually tighten and shorten, gently pulling pelvis forward and downward. This shifts natural body alignment, causing lower back excessive arching and lower abdomen forward positioning, condition called anterior pelvic tilt. This manifests as protruding belly despite stable weight, compressed lower back sensation, and difficult posture maintenance requiring constant effort. This represents normal bodily adaptation over time rather than strength or discipline failure. Common response involves increasing exercise intensity, focusing on abdominal strengthening hoping stronger abs will restore alignment, attempting deeper stretches, longer walks, or demanding online routines. However, many discover posture remains unchanged, lower back stays tight, and body returns to familiar position because body changes through proper sequence, not effort alone. Muscles and nervous system follow specific restoration order for healthy movement patterns. When sequence is skipped, body reverts to established habits. Before strengthening occurs, body requires space creation. Before movement retraining begins, appropriate muscles need activation. This 3-step approach follows smarter movement working with body rather than against it, particularly effective after 60. Movement 1, hip flexor release for tension reduction. First step: create space rather than building strength. Hip flexor muscles at front of hips become shortened from years of sitting, driving, or reduced multidirectional movement. When these muscles remain tight, they quietly pull pelvis forward, placing excessive lower back pressure and pushing abdomen outward. This gentle stretch releases accumulated tension. Place one knee on floor while stepping opposite foot forward, forming comfortable lunge position. Place cushion or folded towel under knee if needed for support. Sit tall through spine, imagining string gently lifting head top toward ceiling. Slowly shift hips forward just few inches in small movement without pushing deeply or forcing stretch. Feel gentle opening along front of hip on kneeling side. Rather than arching lower back, lightly engage gluteal muscles and imagine tucking tailbone slightly downward, protecting spine while directing stretch precisely where needed. Breathe slowly, allowing muscles to soften rather than forcing lengthening. Hold position approximately 20 to 30 seconds, then switch sides. Many people notice simply releasing this area makes standing feel lighter and more upright almost immediately. After 60, progress often comes from consistency and body kindness rather than intensity. Once tension begins releasing, body becomes ready for next step of waking supporting muscles for healthy alignment. Movement 2, glute activation for muscular reawakening. After creating hip space, next step gently awakens muscles many adults unknowingly stop using over time, the gluteal muscles. Glute muscles represent strongest body stabilizers, supporting pelvis, protecting lower back, and making everyday movements like standing, stair climbing, or chair rising feel smooth and controlled. After years of sitting or reduced movement, these muscles become inactive or dormant. When this occurs, lower back and hip flexors begin performing work they were never designed to handle alone. Lie comfortably on back with knees bent, feet flat on floor approximately hip-width apart. Let arms rest gently at sides. Inhale slowly. While exhaling, press through heels and slowly lift hips upward, imagining hips guided toward ceiling by gluteal muscles rather than pushed by lower back. Raise hips only until shoulders, hips, and knees form gentle straight line without lifting higher. Pause here 2 seconds, lightly squeezing glutes as if holding small coin between them. Slowly lower hips back down with control. Move slowly, breathing naturally. Perform approximately 8 to 10 repetitions. Notice warmth or gentle fatigue in back of hips, signaling correct muscles beginning reactivation. This step proves essential because releasing tight muscles alone proves insufficient. Body also needs remembering which muscles support posture. By activating glutes, you guide pelvis toward more balanced position, reducing lower back strain and allowing body to stand more comfortably upright. Once these muscles begin working again, body becomes ready for final step of teaching proper movement application. Movement 3, movement retraining for pattern restoration. Final step retrains movement after releasing tight muscles and activating glutes, preparing body to relearn more balanced and supportive movement. This step transfers muscular practice into real-life actions like standing up, walking, and maintaining daily posture. Begin kneeling on floor with knees approximately hip-width apart. Sit hips gently back toward heels so body feels relaxed and supported. Place hands on hips for awareness and balance. From here, slowly press hips forward and upward until body forms straight line from shoulders to knees. Focus on squeezing glutes to bring hips forward rather than arching lower back. Imagine hips guiding movement while spine stays tall and relaxed. Pause briefly at top, then slowly return hips back toward heels with control. Move slowly and smoothly, repeating motion approximately 8 times. This exercise teaches critically important skill of using hips rather than lower back to create movement. Many daily activities depend on this exact pattern, including standing from chairs, stepping forward, or stabilizing during walking, all requiring coordinated hip extension. When glutes lead movement, spinal pressure decreases and balance improves. For many people over 60, this step feels surprisingly natural, like body remembering old familiar skill. This represents restoration rather than forced change, returning to movement pattern body was designed to use originally. Understanding gentle movement effectiveness after 60. These gentle movements create meaningful difference because body's exercise goals shift with age, moving away from pushing harder, moving faster, or training like previous decades. Instead, body responds best to movements improving coordination, restoring balance, and reducing unnecessary strain. Many later life discomforts originate not from weakness alone but from movement patterns gradually drifting from alignment over time. When pelvis receives correct support, muscles resume sharing workload appropriately. Hips move more freely, lower back relaxes, upright standing requires less effort. Body needs better muscular communication rather than more force. This explains why small intentional movements sometimes create bigger changes than intense workouts. After 60, progress often appears quieter through less tension, more ease, and greater everyday movement confidence. Goal isn't rebuilding younger body but learning to support current body wisely, gently, and sustainably through appropriate movement patterns respecting age-related changes. Performing movements safely and effectively. This routine's beauty lies in simplicity, requiring neither long workout sessions nor special equipment. Entire sequence completes in just few minutes daily. Start with hip flexor stretch, holding each side gently 20 to 30 seconds, allowing front hips to relax and open. Move to glute bridge, performing 8 to 10 slow repetitions, focusing on smooth lifting and controlled lowering rather than height or effort. Finish with kneeling hip thrust, repeating movement slowly 6 to 8 times, paying attention to how hips guide motion. Altogether, routine takes less than 5 minutes. Practice in morning helping body start day aligned or evening releasing tension accumulated from sitting or standing. Consistency matters far more than intensity, with small daily movements repeated gently allowing safe natural body change over time. Safety considerations and precautions. Do not perform these movements without consulting healthcare provider if you have recent hip or knee surgery, acute lower back injury or herniated disc, severe hip arthritis or joint degeneration, knee problems preventing kneeling positions, uncontrolled cardiovascular conditions, or acute sciatica. Even for healthy older adults, start conservatively with gentle ranges and shorter holds, progressing gradually over weeks. Stop immediately if experiencing sharp joint pain, radiating leg pain or numbness, severe lower back spasm, dizziness or balance loss, or significant knee discomfort during kneeling positions. Mild muscle sensation and gentle stretch feelings are normal, acute symptoms are not and require medical evaluation. Realistic expectations and timeline. Benefits develop progressively through consistent gentle practice. Weeks 1 to 2, learning proper positioning, developing body awareness, establishing routine, initial tension release feelings. Weeks 2 to 4, improved standing comfort, enhanced postural ease, beginning alignment changes, reduced lower back tightness. Weeks 4 to 8, clearer functional improvements, noticeable posture changes, better movement quality during daily activities, enhanced body confidence. Weeks 8 to 12 and beyond, maintained progressive improvements, established sustainable practice, clear functional benefits supporting independence, continued postural refinement. However, inconsistent practice limits benefits, emphasizing importance of daily gentle practice over occasional sessions. Integration into daily routine. These movements integrate easily into daily routine. Ideal timing includes morning before starting day for aligned foundation, mid-morning movement break during sedentary periods, afternoon for accumulated tension release, evening for daily strain relief, or combined into single 5-minute focus session. Consistency matters more than perfect timing. Choose times working reliably within schedule, enabling sustainable practice becoming natural habit rather than additional burden. Consider pairing with morning or evening routines for automatic integration. Complementary practices for postural health. These movements work best combined with frequent position changes during prolonged sitting, standing and stretching every 30 to 45 minutes, proper ergonomic support in chairs and workstations, regular walking maintaining general mobility, core awareness during daily activities, and avoiding prolonged forward-leaning positions. Additionally, maintaining healthy body weight reduces excessive pelvic strain, staying well hydrated supports tissue flexibility, and adequate sleep allows postural muscle recovery. Comprehensive approach addresses multiple factors affecting pelvic alignment and postural comfort. Monitoring progress. Track both movement quality and functional improvements. Movement metrics: increased hip flexor stretch comfort, improved glute bridge activation feeling, smoother kneeling hip thrust execution, enhanced body awareness during exercises, reduced compensatory patterns. Functional improvements: easier upright standing without effort, reduced lower back tightness throughout day, improved clothing fit around midsection, better walking posture and comfort, maintained independence in daily movements, enhanced overall body confidence. These functional markers indicate meaningful improvements supporting quality of life and sustained comfort. Conclusion. This 3-step pelvic realignment system provides evidence-based benefits for adults over 50, including released hip flexor tension, reactivated gluteal stabilizers, restored healthy movement patterns, improved natural posture, and reduced lower back strain. These practices require no equipment, minimal space, and can be performed safely at home in under 5 minutes daily. Start with hip flexor release using proper positioning. Practice consistently daily. Progress through all 3 movements. Use gentle approach always. Combined with proper sitting habits, regular position changes, and comprehensive wellness approach, these movements support continued postural comfort, functional mobility, and independence after age 50. Thank you for watching. For specific concerns about appropriate movements for your situation, consult healthcare provider or physical therapist for personalized assessment and guidance. Subscribe for evidence-based information on gentle postural correction and functional movement for older adults, practical guidance prioritizing body kindness while helping you maintain comfort and independence through simple effective exercises.